Well, it's a biomechanic assessment, and we put markers on patients, reflectors, and then we take a digital camera, take 4 pictures of that patient, and it goes over the internet to be analyzed. So we have deviations, postural deviations that are collected from the data that we took with every one of the patients. Then the system tells us, okay, this deviation, this patient has the head tilt forward or dysplear in this instance. And then the system will say, well, this is the kind of exercise you need in order to correct that. So the system does a biomechanic assessment, postural analysis, and gives you exercise to correct those deviations. Yes, you do a first biomechanic assessment, then anytime during the year or the program, you can redo another test on your athletes or patients.
And why do you want to do that?
Well, you want to see if the exercise that you gave them is really working, so you want to make sure that you're on a good track to have improvement with that person, so you can do another test. The good point about this is that it has no danger for the patient. I mean, there's no x-ray, there's nothing, it's not invasive, so you can do as many tests as you wanted to, and it doesn't matter for the patient. The only thing that they have to do is to put the markers on and stand on the spot. Then they have to be tested, that's all, but it's no danger. You can do as many tests as you want.
Well, it was last year during my comeback. I started to have some back problems early in my comeback, and we played in Montreal one night and got in touch with Sylvain and Biotonix and got the test done and started their program, and 2 weeks later I was pain-free, so it was something that really saved my year last year. Well, basically they're finding the problem with the posture that you have and really trying to correct your posture by telling you exactly where the problem is and what you have to do to correct it. And basically it's a stretching program, a little bit of strengthening program, and if you do that for 2 to 3 weeks and continue the program, you should be pain-free. Yeah, after a couple months, they redo the test just to make sure that your posture has changed and you're aligned properly, and to make sure that you keep the pressure off your lower back.
So that's giving you guys like a guideline that you're actually making progress?
Yeah, it's making sure that we're going in the right direction, and that's what we did last year. After a couple months, I got the test done again, and I was in perfect alignment, and that's why I was pain-free. So we like to do it before training camp, just to make sure that your body's in the right position. And if you have some problems, you go back and redo it, and then change the exercises a little bit. Well, my problem has been all these years with my lower back, obviously having had 2 back surgery at the L4, L5 level, and just had the wrong posture, and that's what they found, that I had a lot of pressure in my lower back, and then they gave me some exercises to correct that and keep the pressure off, and I've been pain-free for almost 10 months now. You know, I was very surprised that it was that easy to correct. I've been seeing specialists for the last 15-20 years, and really all these specialists weren't able to tell me exactly what the problem was, and Biotonix was able to do that for me. Biotonix came down this week to make sure that all our players are in good shape, and it's really voluntary for them to see if they want to use the product. So most of the guys have been doing it the last couple of days. Well, I think it's going to help my career in the long run. As far as playing for a few years, I've always said that if my back's in good shape, I'd love to play a few more years. So as long as I'm pain-free and I'm having fun, I'll be out there playing hockey.